So, hello everybody. This is, I'm Ada Wells, physical therapist, certified Pilates teacher, and golf rehab specialist. And today it's sort of an interesting, we're going to do something a little different today. And I was having a conversation with a friend of mine, Dr. Ronald Fudala, and I'm going to have him introduce himself here, but he is a chiropractor, a really wonderful person. And you know, we were having this great conversation about pain and about myths and how people just get their information kind of scrambled in the whole process, and especially where there's a lot of fear involved. And, you know, it was such a great conversation we started. I was like, hey, wait, let's go ahead and actually just record this, because I think you guys will actually get a lot of value in just listening to a couple of professionals just sit here and chat it out about, you know, kind of what we see. And so, yeah, Ron. Introduce yourself.
Hey, Ada, thanks a lot. And to your audience, it's pretty neat how Ada and I met at a business-related seminar, and we found we shared a lot of similarities, and the biggest was the importance of people being able to learn to take care of themselves, particularly for spine problems, and how so many people are better off if they would do that rather than relying on someone else to do it for them. But just a brief bit about me. I have a consulting practice and online service where I help people make good decisions to get the best out of their spine care. Quite simply, I discuss their options and the outcomes of various forms of treatment and encourage them first to do what they need to do to take care of themselves. This business, so to speak, largely stems from my experience as a chiropractic neurologist, and I know that's an unusual term for some. But the majority of my career has not been spent adjusting or treating people directly. It's been spent in consulting and diagnosis, and a large part of that was within a surgical practice. So when I work with patients, it wasn't so much what I did with them, it was how I informed them about their various options so that they could choose which paradigm of care fit their situation the best. But anyway, it's been a pleasure of mine to meet Ada and become familiar with what she does, and which I think is tremendous.
Right. And, you know, I mean, my thing, once again, is helping people pain-proof their lives through mindful and intelligent movement, you know, and that's the whole thing, is teaching people. I think the more we empower people, the more, you know, the better the outcomes. I think, you know, there's a lot of research to support this, but you know, the element of self-efficacy and the fact that, you know, we are what we believe. We will be as good as we think we will. That is hugely, that's a huge part of people being able to improve themselves. And I think one of the things, and I'm sure, once again, you being in a surgical practice have really encountered this, is that the communication style of not only, you know, doctors and you know, radiologists and, you know, and physical therapists and all the people in the healthcare world, that communication style can really, I mean, there can be a couple trigger words and suddenly this person has labeled themselves with this issue and they feel that all their pain is related to this one thing. So, you know, someone has a bulged disc, you know, the doctor says, you have a bulged disc, you have a ruptured that. And suddenly they're in their head, they're like, this is where my pain is coming from this bulged disc or from this ruptured that. But not realizing that pain has actually zero correlation to tissue damage, but pain is something that is, I mean, you have, like I said, receptors that take pain to your brain and say there's something going on, but it's ultimately that series of events that sort of surrounded, you know, not only where you're at right now, but what happened during that event. And that influences what pain level you have. And I think when people sort of realize that, they start realizing some of these things, they understand that they've got a lot more options than just that, oh, I need surgery to, you know, help that one little disc part. This is something that's more of a systemic thing. Don't you agree?
Oh, I do. And there are so many factors that are involved, and the medical system is set up today to disempower people and to make them more fearful. And I don't think it happens by design. I don't think anyone who's a healthcare practitioner wants someone to be disempowered, but that's the way that it occurs. I mean, people have a situation that's limiting them. They go into an office visit that may be 5 or 10 minutes long. They get prescribed medication without understanding whether or not that medication is really covering up the problem or helping to heal it. and having no knowledge of why that initial pain, and we're talking about that initial pain that is due to tissue irritation or injury. And even with that, the degree of pain doesn't indicate the severity of the problem.
Right.
Yet people get so afraid by that pain that they start taking drastic measures, when if they were able to use a few self-care measures and understand what it meant and what to do, they'd likely recover much better than if they relied on someone else to try to do it for them, or if they covered it up to where they didn't feel it well enough and then went back out into the world and did the same things that led to more damage. And that's the missing link. We don't need more technology. There is plenty of technology. There are over 250 different types of treatment for low back pain alone. There are over 25 different professionals treating low back pain alone. Yet, in all this time, with all these new treatments, the outcomes for back pain, especially chronic back pain, have actually gotten worse, because we're being taught more and more that technology is, or should, replace common sense and a good understanding of how people should care for themselves. So, there are good sides to the new technology, but there is also a downside, because what's lacking is good information, self-responsibility, and a common sense approach to things that can be handled with low-tech interventions, usually self-interventions.
Mm-hmm. Right. Knowledge is power. And, talking about fear, I actually just did I did a video on my live, Facebook Live just recently, kind of with our political climate right now. And there's a lot of fear that's being, that's sort of circulating. And the thing is, what I always tell my patients is, fear and stress are actually, those two things have just as much impact on how we move as pain. And, and as I like to say, emotion is motion. And me being a movement practitioner and trying to teach people how to move, and so they can move with, with grace and with, efficiency, that's really difficult to do if you have a mindset, or you have, all these things that are going on, which are creating a lot of this fear and stress around the situation. And, part of that, and I think part of what, you provide, is that service of being able to put some ease, give people some ease, that there are a lot of options. You don't have to just do this one thing that one person told you to. I mean, it's tough when you're in pain, you're desperate to get out of that pain. And that part of that is fear. And this is where a little bit of the, we have to be careful as practitioners in how we communicate with people that are in fear, because like I said, there's a lot of control that comes with, if you're somebody who is of authority and you're talking to somebody who has fear and pain and stress, they are going to be listening to what you say, and they're going to be grasping onto every word. And that may or may not be something that you may say something and inadvertently create more problems in their journey.
Right.
Or at the same time, you have the power to actually create a mindset shift with just that ability to say, hey, you know what? I hear you that you're in pain and you're having this and you have gone to this and this. And sometimes people just need to know that someone has heard them. And if someone has heard them, then it's like, okay, now I can actually hear what you have to say as an option. Right.
And referring back to my experience in the neurosurgical practice, because I did a large part of our initial intake evaluations, as well as developed and ran our rehab centers, and have my hands in a number of things. But let's say that person is in pain and they see their family doctor and the pain is severe, and they get an MRI that is going to show something, as you know, and that's one of the big problems, that MRIs show things that are often irrelevant, even though they're not normal. And in fact, studies have shown that the chance of surgery and the cost of care and cost of future disability actually correlates to having an early MRI and becoming fearful about what is there. Right. So their family doctor sends them off to the surgeon, and one of a couple things might happen. The surgeon may feel there's a surgical case there, and if so, then that's within their realm of judgment. Or they may even say something like, look, you don't need surgery right now, but you're going to someday because this is going to continue to deteriorate and worsen.
Right.
Well, the moment that person leaves the office, every single ache they have for the rest of their life, they're going to be wondering, is this the straw that's broken the camel's back? When there are a gazillion of people out there with perfectly normal MRIs that have the exact same type of ache, but don't have that memory block or engram, whatever it's called, to think back, yes, he told me this is going to happen. Today might be my day. And so they become progressively more limited. They become less physically fit. They worry about their job performance, and their whole life begins to suffer. And once that starts occurring, it's like wrapping a ball with one more piece of yarn that gets so big, it gets very difficult to unravel that initial problem because it gets beyond the physical standpoint.
Right.
So, that's where getting back to information and technology or medicine, proper information right from the start is probably the absolute best thing a person could have, with an understanding of what to expect as they work through the process. Right.
I so agree with that. And, it's what is their journey? What is their path? That is, and once again, what roadmap that they get is really, like I said, they might go on that initial visit and somebody gives them that roadmap of, here's your MRI finding, and your roadmap is now going to take you here, enjoy. And like you said, that person is sitting there going, well, great. Are there any off-roads I can go to try to, avoid ending up at Surgery Mountain? I want to be able to avoid that, and that's what, I think you and I, and with me, my trying to educate people online and being able to give them sort of like that idea that, hey, there's a lot you can do. I don't care that your MRI shows that you've got arthritis. I mean, I care. I know it's good to know, good information to know. But the reality is, like you said, there's a lot of people that have, abnormal surgical looking, MRIs and X-rays. And the reality is, like I said, they have little pain or pain that doesn't necessarily create a disability where they're still able to enjoy what they're doing. And it's like, yeah, I've got some wear and tear, but there's that attitude difference where they're able to go on with their lives. And I think if somebody's got it in their head that somebody else or something else has to be done to me to fix me, they're going to run into some real problems because if they don't have 100% faith in that method and they already have in their mindset that they need somebody else to fix them, it's going to be a really, who knows if that's going to work for them or not, because they've created that situation where they believe it's all passive. And I think there's an element of like what we do or what we can provide for people are those options to facilitate the process. I'm one option, but I'm not the whole option. I tell people, if you don't feel better in a couple of weeks of what I'm doing, I'm not your option. You need to go, elsewhere. And I think that's part of what you provide is that, like you said, you've seen it all, working in that surgical clinic and really knowing what people are coming with, kind of the baggage and the options and the hoops that they've gone through before they've gotten to that point.
Right. And there are two things that you mentioned, and one is about the pathway of care and the other is the fix. And make sure that I talk briefly about both of them, but let's talk about fix. I'll recall years ago when myself and one of the surgeons got in a discussion about that term, because I recognized that there had been several people coming into our service where, I work with physical therapists. I supervise them and help to develop it, and I didn't do the exact care. And I work with athletic trainers and fitness professionals who did a great job. But people would come in thinking, Dr. So-and-so said I was going to be fixed, or he said you're having this episode, you had it twice this year, only once last year, it's time to get it fixed. And I finally asked this particular surgeon, I said, look, if you bring a plumber into your house and you have a pipe that's leaking and you ask them to fix it, what's going to happen? I go, they're going to put a pipe in that's the same or better than the old pipe. The leak's going to stop, and it's going to work for a really long time exactly like it did before. with no problems because it didn't change the dynamics of the way the system works.
Right.
I go, is that what really happens when you go in and you take pieces out that were meant to be there or stick pieces in that weren't there when someone was born? Is that a fix? And I said, so I'm not saying that surgery was bad for this person or wrong, but it's setting someone up for an unrealistic expectation. When you use the term fixed, people think it's going to be better like it always used to be, and I'm going to be immune to any pain, and I'm going to work just like I did before, perfectly. So it's a bad term.
Right.
So it gets back to what we said before, terminology. Now, the other side is pathway to care. A lot of problems arise because in today's healthcare system, where people have to move so quickly to cover their overhead and with their reimbursement rates, and not talking poor about any type of clinician, because most of us do, reasonably well, but the system is set up so that people are passed down the line to someone else who does something. Right. So if the surgeon doesn't want to operate, they don't really answer your questions. They send you to the person that does the injections. If the person that does the injection sees you, they're not going to answer your questions about all the other forms of care because they don't get paid to answer your questions. They're going to do the injection. Then if you go see the chiropractor, it's the same thing. They're not going to sit there and discuss things with you for an hour about what this does and why it does it. They're going to adjust you because that's how they generate their money. And so I'm not saying that everyone's in it for money, because that's not the case, but there is no one in that whole pathway that acts as the quarterback, right, that is able to sit down and speak with someone about what each option accomplishes and how it compares to what optimal healing would be. And that is where everyone should start, is with an understanding of what does optimal healing mean and how every other option compares or stacks up against that optimal healing. And then they'll be better able to make their choices.
Mm-hmm. Right. It's so funny. You call it quarterback. I jotted down here point guard.
Okay, so, point guard. I should have used that because I didn't play.
I'm 6 feet tall. I played basketball.
I was a point guard. I don't know how that escaped me.
but it absolutely is. It's like you've got the ball and you've got that vision of what's going on, across the court, and it's like, okay, who's in the best position to be able to score, to be able to move forward. And that's what you're doing. You're looking over the landscape, seeing what's there, and then being able to say, okay, I've got the ball, but I'm going to go ahead and pass it over here to this person who I know is really good at being able to, drive the boards, or this person over here is going to be able to be really good to do this or that. So I think that is, you are, like I said, you are the point guard. You're the person that's going to help them create that alternate map of their journey so that they know it's not just the straight road, right to, like I said, right to Surgery Mountain there. It can be a road that involves some other little pit stops that actually take them on maybe a little bit more scenic path. It may take a little longer, but it's going to be a lot more enjoyable than having to sit there and have something that is, like I said, just a place where they're coming from, having only one option in that place of fear and not being able to see the rest of the, the landscape. So
right. The point guard analogy, and remind me to remember that, is so cool, because just like a basketball game where you have 5 people in the court and one would look for the most optimum option to be able to get the job done, that's what a coordinator of care could and should do. But just like a basketball game and how the defense changes and takes away what might have been a good option at one point, making another option better at a different point, people's lives change. Their support networks are different. Their resources, their job demands, their fears of what they may have seen in their lives happen to others. And it gets back to those so many circumstances where even though one option could be very good at one time or for one person, as the situation changes, that same option, even though it's good, might not fit into what could be best for the person. And
I agree with that. I was actually having that exact conversation with my husband the other day because he was, and this was relating to golf and golf fitness, like I said, which is something that I do. And one of the things that, he was saying, he's like, you need to be talking about how you make people really fit for golf. And I'm like, well, wait. I said, you know what? I'm a bridge. I'm one part of that. I said, I teach people how to move so that then they have the ability to go on to the next level, right? I'm dealing with the fundamentals of movement and, taking care of all the little small tweaks and the small little pieces that get lost. But then once they have those filled in, they can then move on and progress to that fitness trainer who's doing the more, or the golf professional, or the person who's doing the more intense activity. And so it's a continuum. And there's sometimes when you got to drop back and say, you know what, I went a little too far here, we got to come back. But so long as you know that it's okay to come back, but you don't want to go way back, but being able to sort of know what those options are, and like you said, understand that it's fluid and it's an ever-changing landscape, that you know what, sometimes you're going to hit a bump, there's a storm over here, we got to go ahead and we got to take a different road, and that's all right. We will get there, we'll make it, but just understanding that, like I said, having that person that's there to give them what are those other options, that's what I think is
right.
so important.
And those options are so cool. And it's funny how when you get engaged in a conversation, things pop up in your mind that otherwise wouldn't, which is so great to be able to do this, because to try to sit down and write all of them down, it wouldn't be possible,
Right.
But the timeout analogy, sometimes we need to take a timeout too. In sports, you take a timeout to assess what the situation is, why what we have been doing isn't working,
right,
how the defense or the offense has changed, and then you make your adaptations. And when we get so wrapped up in our busy lives and in that system of medical care again, where you're just shuffled from one place to the next, rarely do people take the time out and say, what was the mechanism of my injury? What happens every day that puts me in a place of harm? What can I do that, even though it hurts, might not be harm? And how can I safely and gently move through that hurt to get better quality movement? In other words, to take a step back, take a time out. Don't think you need to rush into the next situation, and assess the landscape so that you can really evaluate how things are working and whether or not a person could play a bigger role in their lives. And as we're talking also, that one of the other big things that most people, I don't think, really get a hold of is the difference between hurt and harm.
Mm-hmm.
You don't want to do things movement related that cause harm. And so, it's not all about no pain, no gain. But on the flip side, as long as you're moving in a controlled manner that doesn't create harmful stress on the body, it's often better to move through the hurt. Very similar to a rusty hinge on a door that squeaks when you open it. If you just gently and over time, slowly move it back and forth, the squeak becomes less, the movement becomes better, and the body, and in particular the spine, is very much that same way. And it's a little counterintuitive because people think, oh, that hurts, I should stop, which gets back into the fear that has often been, kind of where we've led them to have that fear. So many neat things that you bring to people with what you do with Pilates, and it's not high tech. It's not going to be a Super Bowl ad about how to use more common sense, but sometimes the most pragmatic way to go about things is really the best way.
Right. And, I think that, that timeout analogy, I'm going to go back to your timeout analogy, I think is such a great point, because this is that time where they do have to take a step back, take a breath, and, and have somebody with that clear, like I said, that clear view where they're not muddled by the fear and they have an objective opinion, can kind of give them some of their opinions. But I think the important thing is communicating that to the patient so that the patient sees it. It's not just you telling them that this is happening. It's you're telling them, like, do you see or do you feel or do you kind of see what's going on? and they take that moment and they reflect on what's going on themselves. And once they acknowledge that, once they take ownership of that, then they can move forward. And, and so going to your, continuing under your squeaky door and that sort of that movement, creating that movement and doing it in small steps, that's part of what our thing is creating positive movement experiences so that, it's like, yeah, you might want to do, this big activity, but let's break it down and realize that, this activity we know creates pain. There are a lot of things going on, but let's break it down to the smaller experience and say, hey, you know what? You have the ability to move here. That doesn't hurt, right? No, it doesn't. You know what? Great, because that's actually a fundamental part of this big movement. And when they realize and they start to understand and they see, once again, they see that that is part of the picture, that they hold that they are aware of that, that's when I think everything is so powerful. So I just think it's really cool what you're doing in, helping people sort of see what those options are because they don't have the ability to see that. I'm one of the parts that actually helps them execute it and to see the movement side of things. But like I said, there's so many different components to it, and I'm just one part. There's the nutritional element and what they put in their bodies and how that affects the inflammation in their body. And they may be wonderful movers, but they're stuffing themselves with, potato chips and Coke, and so that's going to be something that until they realize and have had that ability to sort of recognize that that's an important part of the picture. You just telling them to, hey, stop with the Coke and the potato chips, that's not going to do anything, but they have to understand that process and maybe work with that professional that really is able to connect with them with that information.
Right. And having the proper professional is so important because the best professional that any person could have would be the professional that seeks to make them independent. Right. That avoids making them reliant on that professional. And sometimes today, we're not, maybe more than sometimes, we're not really set up to say to somebody, hey, look, you don't need me. I want you to go do it on your own. We're sort of set up to want people to come back to us again and again, whether it's a pain management practice or whether it's one of my colleagues' practice. And not that everyone is like that, but we start believing that too, and we know we're trying to help someone, but none of us out there get paid to say, I don't need to do anything for you, or you don't need to have any type of care. You can just take care of it yourself. So it sounds like I can be overly harsh on the financial side of things, and I'm probably a little bit biased by that, but I mean, there are some pretty scary reports that have been written, papers over the last couple of years, for example, that shows that if doctors are investors in an MRI facility, mm-hmm. someone's 5 times more likely to have an MRI. If they're investors in an ambulatory surgical practice, they're 3 to 5 times more likely to have a procedure that ambulatory surgical practice provides. There was a whistleblower lawsuit years ago for the off-label use of a surgical product, where surgeons were actually getting kickbacks to use the product that was later found to be extremely harmful to the people it was being used in. And the surgical device companies knew about these risks that were somewhat swept under the rug. So, science it used to be years ago that science was the gold standard and we tried to follow this scientific method. But when there are billions of dollars to be earned on back pain, we at least have to be alert to the fact that sometimes conflict of interest can cloud the science that even the best of us read. And it's a very, very difficult thing to do. So,
right. That's a really great point. I mean, even with physical therapy, I mean, there are physicians, there are physician-owned physical therapy clinics, and that's a huge deal in the PT world because, it's like, does that person really need the physical therapy? I mean, I would like to say, yes, physical therapy is great as not only to treat something, but actually as a preventative tool, but to just be referring them within your own system, the question is, do they really need it at the frequency? is that whatever intervention being done maybe a little bit more passive, as opposed to trying to give them the tools and get them out and get them moving? That's the question. People always, they always ask me, they come in and they've got a prescription for, 3 times a week for 12 weeks for, whatever the problem is. And I'm like, you know what, maybe for the first week or 2, we'll go twice a week just to get you going. And then we'll probably just go once a week. And they're shocked. They're shocked at that. And I was, there are times when, yes, you need to have things on a more frequent basis. After surgery, there are some, if you got a shoulder surgery, you got to be coming in there frequently.
Right.
But for the majority of things that are these chronic problems, you know what, this is not a come 3 times a week for 12 weeks and fix it. This is a get educated, understand the underlying components that feed into this problem, understand how this intervention is going to help it, but you're going to be doing a lot of the work on your own and being able to give them that information. And so this is where, like I said, if there's a financial interest on this other side of saying, oh yeah, you need to come more often, that may play into how often the patient thinks they need to be coming into PT. And once they're educated and they realize that, no, you know what, I have this. There's more to it that I'm able to do. I don't necessarily need to just have all this manual therapy. It feels good. Oh, absolutely. I can make somebody feel good anytime. That's customer service. The question is whether or not you're doing something that will create a lasting effect and lasting change. That's what I'm in the business of, is creating change and creating change long-term, not just the temporary, change. And I think when you have somebody like I said, like yourself, who's objective and can see that and has seen sort of like, yeah, from my experience, this is what these people have seen and experienced, but they were in this situation. And, other people were great over here in this experience, but that was their situation. Let's look at your situation. And I know that you take a look at people with their situations, not only on the, what's going on physically, but like you said, even on the financial side. Do they even have the financial means to do that intervention? And is the stress behind the financial part of it going to actually impede the results? Right?
Right. The stress or what their recovery time might be, how long they will be off work, how likely would someone be to return to work? For example, if they had fusion surgery, and I'm not picking on it, but let's use it as an example. Many people in heavy industries will have fusion surgeries, and the studies are pretty clear on that the percentage of those people that end up going back to work is very low.
Right.
And I have seen people who had a back problem that was working, and they were able to work with very little medication, yet they were uncomfortable, have surgery, and then not be able to go back to work. So when I was actively seeing people and when I consult with them now, that's one of the red flags for me, and not the red flag that you look at for severe back problems, but in decision making, is that if someone is working and they're able to work reasonably well, and their pain is somewhat of a mild to sometimes moderate annoyance, I get very reluctant to suggest a big surgery as a solution because of what the statistics show about that. And you and I had talked before, you never want to put someone at risk for losing something that's important to them for the possibility of gaining something that might not be supported by the statistics.
Right.
And that happens an awful lot, or more often than it should, I guess I should say.
Right. Yeah. So there's so much we can kind of go off on. I think this is probably a great place just to wrap things up. But one of the things that I want people to realize as they're listening in on this is that, Ron and I have, like I said, we've connected, but we live on opposite sides of the country, but we still have the ability to help people because technology makes that possible. And, one of the things that I'm doing is really taking advantage of, technology like this, with our conferencing, that, we're able to, look at this person, face to face, read your body language, read what's happening. And it's not just a phone call where you're only getting, or an email where you're just getting one element of the communication, being able to read what's happening. You're able to really see this other person and interact. And I think it's really exciting. And so I just want everybody on this call to realize, so, you know, Ron will definitely have to make sure you can let people know where they can find you. You know, I've got my website, probalance.tv, that people can kind of go and find, you know, stuff that I've written and kind of, you know, the little bits and pieces about me. Where can people find you if they want to hear a little bit more?
Well, you know, right now, and I'm not as far down the road as you are with fully putting together the online consulting service, but my website is spineline.net, SPINELINE.net, and that has my contact information on it. Anyone could shoot me an email, tell me what their biggest problem or challenge is that they've faced, either with their care or the professionals they've seen, and take a look at some of the blogs that I've written. I think you'd be interested. I've written a few about Tiger Woods, actually, and his struggles that he has had. But yeah, that's where you could find me.
Right.
And I really appreciate you having me as a part of this. It was so much fun. I enjoy listening to you.
Well, I think it'll be fun. And actually, when I post this video, for people watching it, just write in the comments below if you guys have issues or questions. I mean, that's just great for us. Like you were saying, you know, what's the biggest challenge you've faced with, you know, having pain or having an issue, and, you know, kind of your journey through the medical world. And, you know, these are the types of things that I think, you know, as healthcare professionals, and particularly you and I have both been, you know, doing this for a long time, you much longer than I have. I've only been doing it for 22 years. I know you have a much longer resume than I do, but it's, you know, people that have been out there for a long time and have seen thousands of people, and really, you know, it's just our experience. If you want to just pick our brains, this is a great place to be able to just, you know, at least get some information in terms of where you can go and where you can turn. Because I think that the tricky part is sometimes you go online and there's, you know, there's you know, this little blog post or that blog post, and we don't really know where it's coming from. We don't know who these people are who are giving this information and this advice, you know. And so I just want people to know, and that's why I loved that's why I wanted to say, hey, let's do this, because you've got so much experience and, you know, knowledge behind you. You're somebody I really respect. And I think that when people, you know, are getting this information from people they know are legit, and, you know, and have seen it and have been through it, I think it really holds a lot of weight. So thank you so much for taking the time. I think this is really fun.
It has been my pleasure. Thanks a lot.
All right.
Have a great day.
You too.